Good afternoon, everyone. Hope you're having a good day. Friday. Hope you've got a wonderful weekend planned. Just a quick video to talk about this experience over the last 6 months with a patient who came to see me with significant pain, both back pain and lower limb neuropathic pain. And I think most of you out there will be able to recognize a significant problem. There it is, the severe structural deficit to the L4-5 disc. You can see the annular bulging, lifting up the posterior longitudinal ligament there, and you can see a little bit of desiccation in the L5-S1 disc and some early changes in the L4-5 disc as well. And when we look at the axial view, just for those who are not familiar with looking at MRI scans, this is our vertebral body. Our disc is at this level, and you can see the herniation posteriorly, broad, centrolateral, and these structures here are the nerve roots of the cauda equina. And some of you may have heard of cauda equina syndrome. Cauda equina syndrome is a severe disruption to the function of the nerve roots that comprise the cauda equina, and it results in quite significant morbidity, often loss of bowel and bladder function, lower limb motor sensory weakness, severe cases you don't walk again. And it usually would present as a surgical emergency, because if you're going to get any function back, you've got to get blood flowing back into these nerves here. And this disc prolapse is significantly compromising there, or putting those nerves at risk of cauda equina syndrome. So the question is, when she comes to see me, what do we do? Okay. Now the natural instinct, as soon as I saw this, I said, okay, we've got to get you into surgery very, very soon. But it's always the patient's decision. You can never mandate surgery. You can never mandate medical interventions, full stop. Any medical procedure should never be mandated. She made the decision that she didn't want to have surgery, but of course she sort of still wants to be guided. And she said, "What should I do, Doc? What should I do, David?" And I said, "Well, my feeling is that you should have surgery, but of course I can't force you to have surgery." And I explained to her what the risks were of paralysis and all those motor sensory problems affecting the cauda equina. And she said, "Yep, thank you, but I will hold off surgery for now. And if I'll have you on speed dial, if I run into any problems, I will ring you at midnight." I said, "Thanks very much." So this is what happened. We sent her straight to do some functional movement therapy, because it's very clear that she has movement dysfunction. Otherwise she wouldn't have a disc that herniates in the first place like this, and she wouldn't have these early accelerated structural deficits in her L5-S1 and starting to happen in her L3-4. So she started doing functional movement therapy, NeuroHab. She did our course. It's a 8-week course, 2 sessions per week for 1 hour, learning how to move biomechanically professionally. Nothing fancy, nothing complicated, nothing outlandish. Learning how to move biomechanically professionally so that the disc, number one, we minimise the chance of developing cauda equina syndrome, full-blown cauda equina syndrome, because of course at this point she was still walking and still having bladder control, still in a lot of pain and having to completely basically restrict all physical activities and stop work. The retraining of her biomechanics protects her to some degree from that progression, and also takes the biomechanical stress off the segment, which then can naturally heal. Okay, so that's February 2023 versus December. Let's just have a look at those. December 2022, February 2023, still, still definitely not out of the woods, but she was happy to push on. And then guess what happened? May 2023. Look at that. Look at that. Just glorious, absolute glorious resolution of the at-risk cauda equina. It's just beautiful. It's a thing of beauty. There's all the little nerve roots. There they are. There's all the little nerve roots. We've got the CSF coming back into the spinal canal. And, oops, look at that. Absolutely glorious. And that is all because we focused on her functional movement therapy and promoted the natural healing without the scalpel. Okay, so I don't think there's too many people that would be comfortable sitting on a patient with this sort of pathology. This is a fairly young patient as well, and saying, okay, you don't want to have surgery, go and do this. Very interesting to hear what other clinicians, other surgeons, other rehabilitation specialists, other physical therapists would have done. What would they have done with this case? Well, that's what I did, and she is absolutely delighted, absolutely delighted. We may even write this case up in one of the peer-reviewed journals. And just another little bit of a sneak peek, bit of info. We are creating our own journal pretty soon. It'll be called the Australian Journal of Functional Movement Therapy. It's coming soon. All the best. Have a great weekend. Bye for now.